Hello, I'm Robert, and this is the second thing that very few people seem to know about how to protect yourself from COVID-19 and to protect others. And I talked the other day in the previous video about how you should isolate right away from the rest of your household to protect them, and that this is what the China did with these big wards. And so then part of what you have to do while you're isolating is you have to monitor your symptoms, and then you have to be careful as soon as you get even the slightest breathlessness or lack of oxygen. So how many of you know what are the emergency symptoms if you need that you need to bring up the emergency line? What are the circumstances? And I find very few of those who I talk to know about that. So these are the emergency signs. And you should all know that. If you've got COVID-19 or someone in your house has got COVID-19, you should know these at least. That if you have trouble breathing, and that means like if you doing above your baseline, like for instance walking upstairs and you're breathless, or you're just breathless just lying in bed, and it's not a panic attack. A panic attack breathlessness usually is over in about 20 minutes or so. And if you are prone to have panic attacks, then you probably know what this feel like. So trouble breathing, or persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. And it's also good to get one of these oxygen monitors. Those are all to do with lack of oxygen. And if you have a lack of oxygen, then you can't home treat. You can home treat the symptoms, and so many people do that, and that's not a good idea. I say it's fine to home treat the symptoms, but not to home treat the symptoms and then use that as if you and not call emergency. If you develop those signs, that's the US CDC say this very clearly. If you develop emergency warning signs for COVID-19, get medical attention immediately. In the UK, it just says if you're a bit concerned about what's happening, then call, and they don't give these list of symptoms for some reason, the UK NHS website. But the CDC does in the US. And that, any of those, the thing is that you're not necessarily going to die straight away or anything like that. It'll take maybe 2 or 3 days or something, it depends. But if you spot those and you ring them up straight away, and then they would talk to you over the phone and find out what you've got, and then decide if it was likely lack of oxygen. And if they thought it was, they would immediately send someone around with an ambulance. And the reason for the ambulance is to whisk you off to the hospital. With Donald Trump, when this happened to him, he just got slight breathlessness. He just got a reduction in oxygen. I'm not sure if he was even breathless. He sent a helicopter out to him and took him direct to the military hospital. And it's the same for everyone, except they wouldn't probably send you a helicopter for you, but they would send an ambulance. And the reason is that they find that if they treat you right away, as soon as your oxygen starts to dip, you've got much better prognosis. And they will almost certainly put you on dexamethasone as soon as your oxygen starts to drop. And then you'll be breathing oxygen overnight as well. And you'll just be constantly monitored, and they'll do whatever is needed to treat you as someone who has got low oxygen levels in your blood. And the COVID-19 is particularly deceptive because for some reason, which is not normal, people can have very low oxygen levels with COVID-19 and yet experience no discomfort, not even difficulty breathing. That's why they have this bluish lips or face. That can happen without the breathing problems with COVID-19. You can just, your face lips go blue, you feel absolutely fine, tapping away at your mobile phone, not even breathless. And the doctors remark about how strange it is that these people who, they're just on the verge of passing out from lack of oxygen, they don't even realise that anything is wrong with them. So you've got to be very, very careful with COVID-19. And that is why, and that's part of what these people would be doing. The people looking after the mild cases in these wards, they'd be keeping an eye on them see if any oxygen level issues. And you could get a monitor for your fingers at quite low cost to keep an eye on your own oxygen, and that's a good idea if you're a COVID-19 patient. So that's my second of the things. I'm not sure how many are going to be, of the things that hardly anyone seems to know. And so check out the links on the video description for these things and follow them up and find out for yourself. All I'm doing is presenting the information for you to connecting you to the good information, so you can check that up, find out for yourself what the experts say. And I'm doing this just as part of the trying to get the good information out there, and because I know from my own experience that so few people know this, and this can literally save people's lives to know this. So many people home treat lack of oxygen. There's no home remedy unless you have someone at home who has medical training in how to supply someone with oxygen and monitor them and do it properly, and even then you'd also have to get the dexamethasone. So anyway, so that's that.